This is the Aware Families Podcast, a show that brings you a science-based, practical look at how to use the principles of functional medicine to keep your family healthy. Welcome back to the Aware Families Podcast. This week, we are going to go over the fourth pillar of health, which is stress and mental health. So mental health and stress management are really key pillars of health, and without them, everything else falls apart. And they're tied in and affected by every other pillar in either a positive supportive cycle or a vicious downward cycle. So really, I think one of the huge take-home points of today is going to end up being there really is no health without mental health.
Yep, you hit the nail on the head there. I think forgetting the mental health piece when we're assessing our physical health is just one of the biggest things that we've done wrong, right, for the past few decades. And now it's becoming more and more apparent how important the mental health component is.
Body and mind are not separate.
Right, we're all one,
Yep.
all tied in. Yeah, for sure. So I think today we are going to kind of break down what it is, right? Kind of start with like, hey, how do we define mental health?
And stress, kind of talk about stress, yep.
Yep, and then go into some of the statistics that we're seeing these days, and then maybe even be able to jump in and come up with some good treatment opportunities.
Yep, and adjunctive things are supportive things that can really impact both stress and mental health, and some potential diagnostic things that I think might be missing the boat on when looking into what could be some of the other root causes for some of the symptoms that people are having.
Right, for sure. We know stress and cortisol go hand in hand, and clearly we deal with that cortisol response on a daily basis here at Functional Medicine Associates.
Absolutely.
Yeah.
And I was thinking, because you've been in the primary care game for a long time, and so you have really hit this on the front line. So as far as some of the definitions and I guess screening tools and things like that, I guess for stress, what were I guess how would you define it and sort of differentiate the types of stress?
Right. I mean, because we do kind of look at both acute stress versus chronic stress, right? So acute, something that's been going on less than 6 weeks, sometimes even less than 3 months if it's a bigger event, versus chronic stress when it's been going on for longer than that amount of time, and all the different implications it has on your health. We, in the clinic setting, use a lot of different tools to kind of understand and break it down, but nothing is more important than just sitting and talking to your patient or the person that's in the room with you, right? And kind of sharing that energy.
I guess why do you think it's important to differentiate that sort of acute versus chronic, and when is it adaptive versus maladaptive?
Right. Yeah. So good example. So if you walk outside and you see or hear a dog barking really crazy and kind of lunging at you, you want to follow your stress response and get out of the way, right? You want to do something so that you're not in a position being chased down by a dog or a bear. So acutely, you need to rescue, self-rescue. The problem is that when your body is in that continued state of rescue, and so you're always feeling like, you're hiking in Glacier National Park and there's a bear on the trail. You don't want to be running into a bear every single day. Yeah. You don't want to have your body feel like it's in that constant state of
fight, flight, or freeze.
Yeah.
Yeah.
So that's, I think, the biggest thing. And we just know that when you've been in that state for a longer period of time, there are more, medical conditions and more medical, issues that come with that. So that's
versus a little bit of stress can actually be a good thing. There's something called hormesis, which is that, whatever doesn't kill you make you stronger, that kind of mentality.
Yeah.
Exercise being an example, it's a stress on your body, on your mitochondria, but done correctly, it will end up with positive growth and positive health benefits. And so there's other things, and obviously like saunas and cold plunge, all these things like that are in a lot of ways an acute stress, but done correctly can end up with positive adaptive responses and health responses. Right. Versus that chronic, that's not a hormesis, not a hormetic effect. It's a wear down and burnout effect.
Right.
So I guess that probably segues into, let's just sort of differentiate, and I think we've done this a bit before, but talking about the sympathetic nervous system and the parasympathetic nervous system.
Right.
So what's the difference?
Right. So in in the sympathetic nervous system, that is, again, where you're in that fight, flight, or freeze response. And so you're in a constant state of go, right? Everything is on the go. Parasympathetic is going to be much more of that rest and relax. And we really need that parasympathetic response daily, most of the day, to kind of, to balance everything. But again, it's how I describe this to the teens in my clinic is honestly like you run into a bear on the trail and you want to know how to respond, but you don't want to be in that response all day long.
Yeah. They talk about like the zebras, they're out on the savannas and they're getting chased by the lion or whatever. Yeah. And then 5 minutes later, they're just back eating grass nothing ever happened.
Mm-hmm. Yeah, they have that great, rotation essentially between sympathetic and parasympathetic response.
Humans, especially in this society,
we don't.
Not so much. Not so much. Yeah. We obviously have talked a lot about the sort of the ramifications of that imbalance, that that huge overriding sympathetic activity, the stress response not being counterbalanced by the parasympathetic. And we had touched on it during the exercise lecture, but using some of the metrics, we're starting to be able to measure this a little bit more effectively, and heart rate variability.
Yeah, you should tell us about that piece. Like how do you use heart rate variability for stress response versus exercise response?
Yes. So that you can also use it for recovery, but also to predict how much you can push yourself. So heart rate variability is a measure of not like your heart rate, but the beat to beat variability in the heart rate. So the theory goes that the more balanced you are with like having an improved parasympathetic tone or improved vagal tone, because the vagus nerve is that nerve that really runs the parasympathetic nervous system, is you'll have a higher heart rate variability, meaning your body is adaptable and it can kind of change, versus if you are always in the fight, flight, or freeze and it's pedal to the metal all the time, there's not that much variability. Like you're kind of stuck in that sympathetic response. And so having a low heart rate variability can be predictive of a whole host of disorders. I think there probably is that we're going to find certain mental health and stress related conditions, but as well as cardiovascular disease. And even now they're looking at things like predicting inflammatory bowel disease flares. There's an article that just came out about this by using heart rate variability, and they could predict when somebody was going to go into a Crohn's or a colitis flare before it happened by watching their heart rate variability dropping.
Right.
And it was a sort of a signal, like a canary in the coal mine kind of thing, that there's something going on there. So that's you can use things like the Oura Ring or the Whoop, or I just got that Morpheus, which is a belt that you kind of put around your chest, like those old polar heart rate monitors that have been around for, 15, 20 years or something like that. But specifically, it's there. It'll measure your heart rate, but also does the heart rate variability, and has some programs to try to predict, like if you are having low heart rate variability that day, then maybe you shouldn't have that be your maximal, push it to the limit type of exercise day. So it's there for performance, but you can also use that for other things, like just chronicling what your heart rate variability is and how stressed out are you. Yeah. And there it's like, you can sort of get some sense of it, but sometimes it helps to have that hard number right there. Like, I'm not that stressed, and my heart rate variability is like 12, or that would be a horrible number, by the way. So everybody always wants to know what's the right number, but it's also, we talked about last time, comparing you to you. Yeah. But general rule for somebody in their, 40s or 50s, I think above 50 is, this is very rough estimate. That's sort of where you're sort of shooting for, but then comparing you to you, so whatever you're doing, is that improving, showing you have better parasympathetic activity? Do you have more rest and digest activity, more vagal tone, kind of counterbalancing some of the stress response? Sort of, I guess, like an objective measure of like, are you less stressed out by this measure? And obviously there's a whole host of other things, including some of these screening tools that, again, I think you have a lot of familiarity with screening for some of the stress related disorders. So when we talk about some of these other mental health disorders, and we'll get into the statistics in a second, but tell us about the DSM-5 and versus I guess these diagnostic things versus just feeling depressed or feeling anxious versus actually having a disorder.
Right, for sure. And I would say, before all, I wouldn't really recommend somebody to just go and download them off the internet, and do it at home without having somebody who's trained and understanding it and knowing like a next healthy step. So I'd be a little bit cautious there. But the DSM-5 is essentially the, Bible of psychiatry. And so it helps give us the reasons why we would consider a diagnosis for people. Some of these other screening tools are fantastic, and we use them every day in the clinic. But again, they're a tool. They're a screening tool that we're going to use with other information. And so we really have to take them in the context of that, knowing that it is not a end-all, be-all diagnosis.
Like, what would you use most frequently in the clinic setting?
So the two that I use the most are the GAD-7, the GAD-7, and then the PHQ-9. Those two are probably the ones used most frequently in primary care. So the GAD-7 is an anxiety screening tool. And so both of the GAD-7 and the PHQ-9 are going to take in the last 2 weeks of time, have you never experienced this symptom, somewhat experienced it, more than half the days, or nearly every day experienced it. And then, there's 7 questions for the anxiety, and then there's 9 questions on the depression. And the last question is a suicidality question. And so, again, having the understanding of how to interpret that data is huge.
Yeah. So
I really don't recommend just going and grabbing them.
Yourself.
Yeah, not a thing. I would highly encourage you to follow up with somebody you trust, and, a counselor or your primary care provider, something like that.
And anybody who's been to their primary care provider or their child's primary care provider recently is, I'm sure, probably gone through this, because with the rates and the numbers that we're going to talk about in a second, these things are so prevalent and still yet, I think, in some degree, underdiagnosed.
Very.
And so recognizing that there's a problem early on is going to improve outcomes. So even though we got to go through this again or whatever, but this is serious business. And when we talk about the statistics, you're going to see why these things are being screened as much as they are, and probably actually need to be screened more.
Right. And having the time to have that follow-up conversation. This is not a 4-minute conversation with somebody, nor should it be. Because we just know, like we mentioned earlier, stress impacts every aspect of your life.
Yes.
So it is huge.
Yep. And stress is tied in directly with depression. Stress is tied in directly with anxiety.
Yeah.
They're really all kind of the...
Yep. And you can have multiple, you can be suffering with anxiety and depression at the same time.
Absolutely.
And there's different criteria for providers to diagnose, those. There's different subsets of depression as well as anxiety.
So we're not going to try to diagnose anybody today and go through the things, but just know that these are tools. They're used with your primary provider, and they are useful screening tools.
Right. Yeah, and there's even, there's the resiliency screening tool, which is great too. It helps talk about, hey, what do you have that helps build your resilience? Like, what is effective for you? And it can give your provider some information on what you have as, backup, like what's going on in your life that's providing support.
And I think that it's more from psychiatry. I think they use the Beck Depression Inventory.
Yep.
Because it's a little more
more in depth. Yep. And then there is a Beck for postpartum as well.
Okay.
So there's a couple screening tools specific to postpartum moms, because we know that the hormonal flux that happens then is dramatic. And again, I actually did my master's thesis on that. So there's a lot of information out there. But we could talk about that for hours.
Yeah.
So.
That might be another podcast.
Yeah, right.
So how big is this mental health and stress-related issues? How big is the problem?
I think this is one of the largest problems we have right now, and I feel like it's tied into most other visits. Right? So the number of physician office visits with depressive disorders is the primary diagnosis, right? Because you might come in and leave with 4 or 5 different diagnoses. But as the primary diagnosis is 15 million.
Yeah, which is no joke. And depression is well known to be the leading cause of disability worldwide. So, lost days of work, lost productivity, school, you name it. It's a huge, huge, huge issue.
Right. One of the things that I always find, I don't know if interesting is really the right word, but in my practice, I would say half of the visits, 50% of the visits, have to deal with anxiety, depression, stress. Because
it's informing whatever else is there, whatever other symptoms.
You might be coming in with tummy aches, headaches, something that's not going away. And really it might be that we're having, some mental health disorders, conditions occurring.
Or vice versa, secondary to whatever else is going on. Hormones are out of whack. Boom, they can have these other cognitive or
mast
mood.
cell disorders. That one's a huge one because some of the side effects with mast cell disorders are basically anxiety type side effects, and so a lot of folks will get diagnosed with anxiety before the mast cell disorder, and really it's a consequence of the mast cell.
Celiac, same thing. A ton of so we'll talk about this in a few minutes, but it's interrelated with all these other things. So that 21% of adults in the United States will go on to develop major depressive disorder at some point in their lives. I mean, some of these numbers you're looking at, that's 1 in 5.
It's wild. Yeah, it is wild. Major depressive disorder affects more than 21 million American adults, or 8.4% of the U.S. population age 18 and older. I feel like that's low. I feel like it's probably higher than that. But most recent data that we found,
And almost 7 million adults with generalized anxiety disorder. So 3% of the population, less than half are receiving treatment. So that's another big issue right there.
Oh, huge, yeah. So one of the things that you and I were talking about, I don't know, one of the first podcasts, I think, just the study of anxiety and particularly in kids, right? So there's this new book, relatively new book. It's called The Anxious Generation by Jonathan Haidt. Eye-opening in understanding the implications of stress on our kids and some of the things that, this author and the studies that he brings into that book, what he's, attributing to stress and anxiety and depression, and really the influence of social media, the increase in screens, the decrease in outside time, and really everything, is connected to a certain year when all of this started.
And COVID hit the afterburners on this. They actually, I think it was almost like a doubling of the rates of some of these disorders.
And you can see why.
I know. And I don't think we haven't pulled out of that tailspin yet.
Right. There's also another youth screening tool that's been available by the CDC. It's the Youth Risk Behavior Survey. They conduct it with the OPI, so the Office of Public Instruction in each state, and they essentially do a screening survey of middle schoolers and high schoolers, and they ask all kinds of questions, and so it's super eye-opening. Dietary choices. How many times do you eat a salad in a week? How many times have you had carrots on a plate? Like, really, those are some of the questions. Sleep. Driving in a car with a seatbelt, or have you ever chosen not to? And then alcohol, tobacco use, mental health. And so that survey has been around, like I said, for a couple of decades now, and you can watch the trends, and they are disturbing.
Yeah.
Yeah.
So 10% of kids 3 to 17 had diagnosed anxiety, and I think this is from the CDC website. And then 4% of children ages 3 to 17 had current diagnosed depression.
Right.
So double the rate in females as compared to males. And then, I think some of the stuff in the adolescents, I think this is from the CDC and NIMH, the National Institute of Mental Health.
Oh, yeah.
That 43% of high school students reported feeling, and this is from 2021, 2022, 43% of high school students reported feeling so sad or hopeless for 2 or more weeks in a row that they stopped doing their usual activities.
Right.
I mean, almost half.
Yeah,
so
almost half. Yeah, I think that was in that Youth Risk Behavior Survey, which is, again, done by the CDC. And so those are all self-assessed, right? So the students are kind of reporting how they're feeling. And it just, is it that they feel safe enough to report in that environment, right? Or are they telling other people? We can hope.
Yeah. But it gives you a little peek into that there is a lot going on there.
Yeah.
And then, I think from that same survey, so U.S. high school students, 2023, 40% reported persistent feelings of sadness or hopelessness in the past year.
Right. So persistent, over 2 weeks. Yeah. Right? Over 6 weeks.
Yeah. Not just like, I'm kind of bummed out today.
Like I broke up with somebody or,
This is a long-term issue.
The other thing I thought that was interesting in this last one is they talked about bullying. So 25% of high school students reported being bullied on school property. And then another 20% report electronically being bullied. So, gaming, social media, right? Any texting, so they're doing these Snapchat things where they text pictures and then they go away and there's no record. I mean, it's wild.
Yeah.
It's a different world. It's not one that we grew up in where we didn't have a record of everything.
Yeah. I know. Tough. Doesn't live forever on the interwebs.
Yeah.
So then leads us to the probably most shocking and scary part of it is suicide, and the rates of suicide and kids and adults, and where we're heading with that. So in the adult world, about 50,000 suicide deaths annually, so about 14.8 per 100,000 adults.
Right.
But then when you look at, and some of these numbers, I don't know how, if they're real or not, because they're so shocking.
High. Yeah.
Like the high school students, 26. So yeah,
26%.
Over 1 in 4 high school students reported they had seriously considered attempting suicide in the previous year.
Right. 16% reported making a plan. 9% reported an actual attempt.
I mean, that's unbelievable.
Yeah. Oh, I know. We, in the state of Montana, so there's a suicide prevention coordinator for Montana DPPHS, so Carl Roston, and he has a lot of information about this, and he travels around the whole state giving presentations. Actually, was able to attend one probably 2 years ago. He does a fantastic job in getting the awareness out and understanding, hey, what are next steps? What can we do to, if someone comes to you with concerns, what is a next step that's safe?
And it's not all teenagers.
It's not.
Unfortunately, I know, firsthand from being in pediatrics and people I know who work in pediatric intensive care units and stuff like that it's the age is decreasing, like 9, 10-year-olds, so it's pretty rough.
And then in Montana, we've ranked in the top 5 for suicide rates in the nation for the last 30 years. 30. Yeah. There's a lot of stuff out there on that, Is there a rurality component? Is there, cold?
Yeah.
Like I mentioned earlier, I did my thesis on postpartum depression, and so latitude, the amount of sun. We are in a very cloudy space up here where we are. We don't get that sun and the vitamin D.
We're on the bad end of that Jimmy Buffett, changes in latitude, changes in attitude.
True, I know.
Then I think really closely related to a lot of this are the ACEs. So tell us about the ACEs.
Right. So the ACEs, adverse childhood experiences. This is a questionnaire that was designed to essentially assess your traumatic experiences that occurred to you or around you before you were 18, so that you were, a part of, essentially. The higher the score, the more the traumatic events that this individual would be exposed to. So some of the things we were looking at are like abuse, neglect, parent separation, divorce, mental illness in the family.
And there's physical, sexual, and emotional abuse, all of which rank on
all
there.
3, and all 3 are on there. But 64% of adults in the U.S. report they've experienced at least one ACE before the age of 18, and 1 in 6 have experienced 4 or more.
Yeah.
I mean, so it is, it's interesting. 3 in 4 high school students reporting experiencing 1 or more ACEs, and 1 in 5 experienced 4 or more ACEs. Most common in the high school realm were emotional abuse, physical abuse, living in a household affected by poor mental health and substance abuse. So,
and this is a setup for things
your whole
decades down the line that we're really, I think, finally starting to pay more attention to, and not just things like depression and anxiety, which are obvious, and then it sort of feeds. It's like a feed forward thing with PTSD,
autoimmune disease, all of it,
heart disease,
cancer,
just all
stroke,
cause early death,
mortality,
all cause mortality are tied in with these adverse childhood experiences, and I think sort of that saying like, and just not being addressed, that not getting the right help for those things, and which it's not like, oh, this happened, you're doomed, but like really we need to pay more attention to it. There needs to be not just a screening, but really somebody who's well versed in trauma therapy.
Yes. Yep, huge. So Dr. Nadine Burke-Harris, she is from California. She's a physician out there, and she has really been an expert on these ACE scores. She's written a book called The Deepest Well, which is fascinating. It's a wonderful book. I highly recommend it. Another book, The Body Keeps the Score by
I've read that one.
Dr. Bessel van der Kerk, really talks about how trauma shapes your body and your brain.
And your genetics, right? Your epigenetics.
Dr. Harris talks about that too.
Yeah.
Yes. Yeah.
It's crazy. Like,
and the power to change it.
Yep.
So it's not like it's a sentence that you're just, this is what's going to happen.
But this like multi-generational trauma, that concept is wild.
Agreed. Yep.
And, we talked about the whole cortisol thing before, and we'll talk about that again. But that impact of those ACEs, those adverse childhood events, again, decades later on having your basically adrenal dysfunction and having this adverse cortisol, one of your main stress hormones, and just having this abnormal response that then can lead to all these other symptoms, and that they're now really starting to be able to tie that in with people who had these adverse events, when they were
at a young age.
Very, very young.
Right. And then maybe didn't receive any of the, counseling or therapy.
Exactly.
Yeah.
Yep.
For sure. So what do you think? We know the rates of all these disorders are rising. Like, what are some of your thoughts on how all of our 6 pillars can affect stress and mental health?
And I was going back through with some of our training lectures about this topic, and there's a slide on there, and it had the former director of NIM, the National Institutes of Mental Health, Thomas Insel, and he was basically made this statement acknowledging that it's not just like depression is one thing, anxiety is one thing. He's like, it's symptoms, but there are many roads that lead into that, and sort of. And also talking about the fact that there's a good proportion of people that if they're just on this monotherapy, just trying to treat it pharmacologically without going through looking at the other things, that it's way less than 50% effective to treatment. So that these are really whole body and whole person disorders, and that there's many roads and many things that can kind of lead into it. It's not a serotonin deficiency, that there's so much more going on.
Right.
And so I think that it really does tie in with exactly what we're talking about in these early podcasts, going through these 6 pillars.
Yeah.
Because this is a pillar,
right,
but it is tied in and influenced by all the other pillars.
Every other one.
and if you're not taking care of those other ones, things can start to break down. And this is one area that it can start to, I think, can start to show in.
Right. And maybe this is the first sign, right? Maybe this is one of the first things.
The canary in the coal mine.
There you go.
Yep. And there's a lot of these, and that we, again, when we are breaking stuff down in functional medicine, we look for these things. Okay, this is not the end game kind of thing. What else is this telling us, or how do we follow the trail upstream from whatever this set of symptoms are to what happened maybe as a young child or whatever kind of stuff you're exposed to. But I also think it's interesting, and we'll talk about these books a little bit later too. But it really seems like 2 of the main players in mental health and brain health are inadequate brain energy, which is actually a book that we'll talk about in a second, low brain energy, and high increased brain inflammation.
Yep.
And this goes across the board, whether you're talking about depression, anxiety, ADHD, autism, Parkinson's, Alzheimer's, and interesting too, if you are diagnosed with depression or PTSD, you have double the rate of Alzheimer's. So these things are, again, talk about the canary in the coal mine effect. I think that's pretty interesting.
Yeah, and the metabolic component.
Yeah.
Which then how does that tie into, the other 6 pillars?
Yeah, I think, mitochondria, we always kind of harp about that. If your mitochondria aren't happy, ain't nobody happy.
Or have energy.
Or have energy to do anything.
Have the ability to be happy.
So all these, I think all the other pillars that we look at are really, how do they impact things like that energy production, the mitochondria, the brain and body energy. How do they affect inflammation? Those are a couple of the key players. So food, obviously that was our first podcast, but what do you think about the modern food system and how that affects our mental health and stress?
Yeah. I mean, I really just go back to food and the actual nutritional value of food and what we're getting out of the food we're eating. And if we're eating highly processed food day in, day out, what nutrients are we really getting?
Calorie rich, nutrient poor.
Exactly, right? And so, you're full, but, how is everything else going?
And it actually represents a stressor, right? That food stresses your body out.
Yeah, right. Your cortisol can go up or really down at some point too, which
if you're riding that blood sugar roller coaster.
Yep.
Because that's another thing too, right? The reactive hypoglycemia is basically an anxiety. It's an anxiety kind of stimulus, right?
I know.
There.
We kind of joke, right? We watch those commercials on TV and they're like, "Oh, so and so's hangry. Give him a
Snickers.
Candy bar." Yeah, I know. And but what is it? It's really a blood sugar change, and so you're having a massive metabolic change based on that, and then you are having you're responding with an anxiety, anger, irritability, all of that.
Yeah. So
I mean, we know it happens. Everyone knows it happens. They just know it by other names.
Yep. So there's the blood sugar part of it, the metabolic part of it. There's the lack, and we'll talk about this when we talk about some of the testing, things like that. But like, some of the key nutrients that are deficient in a lot of people's diets. So what are the first things that come to mind as far as like common nutrient deficiencies?
Well, I mean, I think omega-3 fatty acids for one.
Yep.
But vitamin D.
Yep.
I mean, gosh.
In kids, zinc is another
zinc.
Common one.
Right. Vitamin A.
Fiber. Yeah. All of which will relate into the brain. Again, if you don't have the raw components to make the right neurotransmitters and to keep those neurons, the nerves in your brain healthy, how can you expect not to have some issue, and it can manifest a bunch of different ways. But if you're not focusing on some of the basics, if you're not feeding the brain what it needs to function properly, how can you expect it to function properly? It don't make sense.
And part of it, I think, is people, we really didn't, for a long time, didn't really know, right? Because everyone was trusting what was being told, hey, low carb, high carb, low fat, and so everybody was trying to do the right thing. Eat the cereal that says it's heart healthy. Do the things that they're being told. So I feel like now we're just bringing awareness to help start maybe making different choices.
Yeah. And we'll talk about this a little bit more in a second here. So, and then one of our more recent exercise, our podcast about exercise.
Yeah. What do you think about that? How do you feel after exercise?
Yeah. It's like, they talk about the runner's high and all these other things like that. It's, there's the short term and the long term, right? There's like sort of paying your immediate self and paying your long-term self. But that, we talked about the whole fight or flight and that parasympathetic, sympathetic balance in the body. One of the best ways to do that is physically training your body to have better vagal tone, parasympathetic tone, which is exercise. And I think both factors, we talked about the importance of cardiovascular exercise, that so-called zone 2 type of exercise, but also some of the more intense stuff if you are cleared for it, weight training, because both of them help those mitochondria. And the healthier the mitochondria are in your body and your muscles, the healthier the mitochondria are in your brain. It's directly linked. So, and they talk to each other. So, I think that you can't have a healthy brain without a healthy body.
Right. And movement is key.
Movement is key.
How about, so this was an interesting one too. How about lack of play and increased focus only on work? So never, letting your guard down to just play. Yeah. Like, what does that do to our stress levels? If we're on all the time, 24/7, we're always on, and we're never just laughing or enjoying something,
Never know what that's like going through residency or any of those type of things.
Right. But what that has a major impact on stress levels.
Oh yeah.
Chronic stress levels and health, hypertension, so your blood pressure raises, your cholesterol raises, your blood sugar raises, because the longer you're stressed, your sugar goes up.
You're living in that sympathetic drive.
Always. Yep.
And sleep, of course. Whole podcast on that.
We have a whole podcast
on that. But again, that without proper sleep, how can you expect to have good mental health?
Right. You wake up
doesn't,
tired, constantly tired.
Sooner or later,
it'll catch up.
It'll catch up to you.
Lack of connection, community, and purpose.
This is huge.
Huge. I think, kiddos naturally go to each other, right? Because they know they need community. They need that connection with others. And sometimes as we get older, we lose that a little. And I really, that's one of the big things that I know you and I both stress is you got to have community. You have to have a reason for getting up every day, a purpose. You have to have those people that are, around you and working forward or, moving forward together.
And sometimes it's animals, right? I was thinking about this too, like having a pet or, volunteering at a, animal shelter or something like that, like that connection and that having animals that need you and are counting on you, and that connection there as well can be, literally life-saving in some cases. So
I'll remind my pets.
Yes. You better appreciate me.
Yeah.
But yeah, that sense of purpose, I think, is huge and something that, again, it's always sort of easier said than done. And obviously finding a grander purpose. And it doesn't have to be always the grand thing, but just finding, helping somebody out. And it could be through multiple things, through the school, through your church, through a community organization, volunteering, other things like that. Just, something outside of yourself that is, you feel like you're being helpful or useful, I think, for, especially as we age, is huge.
somehow
mental health.
giving to others in a way.
Yep.
You know, yeah. How about, what do you think about just going outside?
Yeah, I think there's so many aspects to that, right?
Yeah.
There's, as we're in the doldrums of winter now in Montana,
Negative
and,
18.
and the sun, only see little glimpses here and there. There's the sunlight and that light part of it. We talked about this for the sleep part of it, but that exposure to morning light, and whether that's, obviously in the best case, natural light, sunlight for 10 or 15 minutes, or one of those full spectrum lights, they call them the sad lights or the happy lights, where you have that in the morning for, 10 or 15 minutes while you're just starting to get ready or whatever. And that light hitting your eyes, not only does that kind of help set your rhythms, your sleep and wake rhythms, but it kind of has a natural antidepressant effect. And some people, seasonal affective disorder, it's variable how much it affects people. And there's some thoughts that some of that could be vitamin D deficiency, but some people, that light bit of it changes the way their brain chemistry works. And it's, hugely effective at raising their mood and just making them feel better overall.
And it does seem more pronounced the more north we get. So, again, that
Absolutely.
was part of what I did in my thesis work, was I compared postpartum mamas from down south to up here. And so, whether it be lack of light, vitamin D, cold, staying inside all the time, right? Like, what are the pieces? But winter is harder.
And there's the nature piece of it too. Yeah. That not just the sunlight, but being outside, touching the earth, just being around.
Yeah. Yeah, even like skiing, right? So we get outside, we ski, you get fresh air, you freeze. So you have a little bit of like cold stress, right?
A little hormesis.
Little exercise. But then you're outside, Skiing's great.
So
it hits a lot of things.
Yes, I think it hits a lot of things. And this will be probably a whole separate podcast on itself, but it kind of relates into food to some degree, but also just the toxic soup that we're swimming around in. And a lot of these things that we're discovering are neurotoxic. They're toxic to your nerve cells, your brain cells.
Fragrances and
all the the things, the endocrine disrupting chemicals, EDCs that we talk about, heavy metals, lead, arsenic, mercury, all horrible for your brain.
Right.
Aluminum, not great either. Like a lot of these other things that can kind of sneak into, again, food additives and other things like that. Pesticides, they kill bugs because they kill the bug's nervous system, but unfortunately we share some similar things with the bugs. And so pesticides, herbicides definitely can affect the brain as well. So you're not saying this is the cause of all mental disorders or anything like that, but these can be contributing factors, and if you're really looking at treating the whole person and doing other things to try to help that brain work better, to have better energy, to have less inflammation, you got to pay attention to some of the toxic junk.
Right. Yeah. For sure. And again, just like you said, we're not trying to downplay anything and make it sound like one of these is going to fix everything. And that's not the case. It's just these are pieces that can contribute to the whole and can contribute to, different feelings that we're having as humans.
Yep.
So what about like lack of coping mechanisms and guidance, maybe that lack of resilience that we kind of spoke of earlier?
Yeah.
Yeah,
what is it? Comfort Crisis? Isn't that another book that just came out pretty recently? But that whole thing where, we're in a lot of ways so used to getting things pretty easily compared throughout human history, right?
Oh, right, yeah. When you need bread, you just go to the store and buy it. You're not out doing the, milling the wheat and grinding it.
And but that sort of the bad side of that is that when some challenges do arise, that we don't have the framework in order to deal with that in a productive, healthy manner.
Right, which is one thing I have to give a major shout out to a lot of our school counselors, because they are working day in and day out to help those kids at schools build resilience. Truly, I think they are underappreciated. They have this job where they are dealing with some of the hardest things, and they do it with
bad
grace
social
and
situations
love.
and
I just cannot say enough amazing things about the school counselors we have. And I really do think like they are putting serious effort into helping kids build resilience.
Yeah. And
amazing.
Tied in with that too, like some of these schools will have mindfulness programs, whether it's sort of like
our
meditation
awesome.
or even like less official things, but just that are really kind of sneaking mindfulness in. And there are organizations, I'm spacing on them right now, but there's a couple websites where their whole thing is increasing mindfulness activities in school to improve the mental resilience of kids.
That's awesome.
Because it would be the Zen warrior, right?
Right.
It's kind of
Right.
they're keeping that parasympathetic tone
Yes,
up there.
right.
They're not living in sympathetic
they're,
fight or flight.
They're
24/7.
pausing between, stimulus and response.
Yeah.
Yeah.
Yep.
Right. What we all need. And then again, the role of social media, like we've said many times. I can tell if I've done social media for too much, and when I need to kind of back off a little bit. But I'm an adult, right?
That'd be a study.
Yeah. Oh gosh.
It's heart rate variability while doing a lot of social media. Heart rate variability on a social media fast.
Yes. A social media fast.
That would be
That's
interesting.
I like it.
Yeah.
Oh, I like it.
So.
Yeah. So what can we do about it?
Which we were kind of segueing into that with some of the last stuff that we were talking about. But again, to your point, we're not saying we're not trying to downplay whatever people have going on. We're not trying to say that their diagnosis is insignificant or whatever they're kind of battling. I think it's really the point is that get as many beneficial things in your corner as you can. Pay
tools
attention.
In your toolbox.
Yep.
That's what I always tell kids. We need tools in your toolbox. Once you have them, you have them. You can pull them out and use them anytime you want.
Yeah, and it's like with all the rest of the healthcare crises in America, we're not going to drug our way out of it, and we're not going to cut and surgerize our way out of it. These are
you're going to have to do the hard work.
Addressing the core things that we're talking about, these pillars, to start supporting your body and your brain.
Mm-hmm. For sure. But again, you might need to, reach out to your primary care provider. If you're seeing a psychiatrist, by all means, continue. Like, we're not trying to say don't do any of those things.
Yeah, no, just build your team.
Extra.
Come see us here, Functional Medicine Associates, but again, we work with these other providers. It's not like stop all these other things. And, it's a team approach and getting a good comprehensive plan together.
For sure. Yeah. We kind of already talked about how, we got to pay attention to all the pillars, not just the one.
Yep.
We need to prioritize sleep. We need to exercise. This might be a great spot for you to play out your brain energy book again.
Oh yeah. Chris Palmer, Harvard psychiatrist. And he
Such
sort
a
of
good book.
came upon this, I don't want to say epiphany, but whatever, realization by treating some of these patients that he had were really refractory, severe bipolar, schizophrenia, some other mental illnesses who also happened to be really obese and either type 2 diabetic or pre-diabetic and really heading that way fast, and ended up putting them on a ketogenic diet to try to just help the metabolic part of it, because as a lot of these bipolar meds and things like that, they actually make you insulin resistant, make you gain a lot of weight, and can...
Say what a ketogenic diet is real fast.
So ketogenic is low carb, higher fat, where your body breaks down the fat and uses these little energy molecules called ketones that actually can bypass. And some people, with the way that their chemistry and their mitochondria are, they don't burn carbs as efficiently as they should or could, and so it sort of like makes their brain a little bit toxic when they have these high carb diets and they can't burn all of it. Then there's all these sort of byproducts that can happen and can cause a host of issues. But by going to this sort of ketogenic diet, or sometimes just adding purely what we call exogenous ketones or medium chain triglycerides, brain octane, which is like that. It's a MCT oil, medium chain triglyceride from coconut oil, where it will make your body make some of these ketones and actually can give your brain a little boost sometimes. And so, again, harmless thing to try, a small dose of that, and just to kind of see, does your energy get better?
Do you actually?
Yes, exactly. Do you feel more clear-headed?
Yeah.
And that sometimes can be a little indicator, like, oh, I'm not doing well on this high carb, especially high simple carb diet, and maybe more fat, and teaching my body to burn these fat and these ketones can be better. So he found that when they put these patients on a ketogenic diet, that all of a sudden their symptoms, I wouldn't say were gone, but were dramatically improved.
Right.
Were able to go off of a lot of their meds or down on their doses. And after, the however many patients he treated like this, he's like, there's something going on here.
Right.
And, his impression that there's something at the root cause with the brain energy being out of whack, the mitochondria in the brain being out of whack as far as what it can burn for fuel, in a huge swath of people with a host of mental and brain disorders. And so, definitely an interesting book. Take a very different look on it. But again, sort of fostering that thing, like you're not suffering from a serotonin deficiency per se, but how do we get your brain functioning better, that energy in your brain functioning better?
Right. And then even, starting a practice every day of meditation or mindfulness, prayer, yoga, right? Something that you are pausing and
get out of your own head.
Getting out of your own head. Yeah. We are So good at staying there.
and done correctly or
Yeah.
whatever, and it's it's just the practice of it, right? It's not a perfection, it's a practice.
Yep.
And that will both help lower that sympathetic drive, raise that parasympathetic tone, that vagal tone.
Yeah.
And again, just sort of sometimes help you get out of these thinking traps and this sort of obsessive thinking, and
Right.
and just that objectivity, just stepping outside yourself and
Right.
then taking that 10,000 foot view and being like, all right, maybe I'm getting a little over the top about whatever I'm getting worked up on.
It's good for us to do. I know. Like, it helps me.
Yeah.
So.
Oh, for sure.
Yeah.
And there's a host of things, a starter thing like Headspace, that
Yeah.
app. They have one for kids.
Yeah.
It's easy. There's things on little videos on Netflix on it and things like that. So even starting with something like that, can have a lot of benefits. And then again, there's the school-based programs and stuff like that too. So I think that has huge role for potentially helping. Again, not done in concert with all these other things. I think is another tool in your toolbox.
Another tool in your toolbox. Yep. Also, reaching out, getting help. So there's a number of different licensed folks that can help. So licensed clinical social workers, so LCSWs, LCPC, which is a licensed clinical professional counselor, licensed professional counselor, licensed mental health counselor. Every state kind of does a different credentialing process.
It does get confusing.
And it is. But if you kind of get those initials, you're probably okay. But then somebody, psychologist, psychiatrist. But then somebody has the training to handle what you're bringing them.
Yep.
So if you're having, a history of trauma, if you have, a high ACE score, all of those different things, you have somebody who has
get somebody who's trained in trauma therapy, because that's a whole separate deal, and having somebody who's well versed in that experience, it's worth the weight in gold.
For sure. Yeah. And a lot of these folks will do like a free 15-minute consult on the phone to make sure that that you guys are a fit for each other.
Yeah, because you got to click with that person.
You do. Yeah. And so I highly encourage calling around. A lot of employers have, 4 or 5 free counseling sessions. Sometimes you can choose, sometimes you can't, but it might be a good start, break the ice.
Yeah. Absolutely.
Yeah.
We already talked about limiting social media. We don't need to keep beating on that. And we talked about getting involved, helping others.
Right.
Kind of back to the diet piece too, the brain-gut link we maybe talked a little bit about earlier, but those gut bugs, that microbiome, the hopefully probiotic bacteria that are living in your intestines are running the show.
Yep.
They make stuff that actually alters your mood. Most of the serotonin is created in your gut, in these little cells in your gut, and not in your brain. Like 80 to 90% of the serotonin is in your gut, not in your brain. So if you're eating a bunch of junk, not eating a bunch of, you have very low fiber in the diet, which is what the probiotic bacteria need to thrive on. If you're getting a bunch of these food additives that actually kill the good gut bacteria, this can have huge downstream impact on brain function, across the board.
Right.
Whether you're talking about these mood disorders, anxiety, ADHD, Parkinson's, Alzheimer's, all these things. So, feed the gut, feed the brain.
Yeah. For sure.
I think it's important, and eating more whole food diet, getting your 20, 25, 30 grams of fiber a day, depending on how old you are. And there's something called the MIND diet, MIND, which is it's basically a Mediterranean style diet, but specifically for people with both like mental disorders, but also I think as a protective against some of these neurodegenerative diseases like Parkinson's and Alzheimer's. And there's some preliminary data that it is shown to be brain protective, so something in that whole food Mediterranean style diet I think is likely to have some benefits.
Yeah, for sure. We already talked about kind of like the brain toxic chemicals to watch out for, utilizing the SAD light, the happy light, right? Infrared sauna, red light therapy, the potential impact from that.
Some people really notice a difference because as the theory goes, that there's certain wavelengths of light that actually can go in and stimulate your mitochondria directly, and there's certain wavelengths of red light that kind of fall in this category. So it's not just you go in there and you get a good sweat going, and that gets rid of some of the junk and your toxic stuff in your body, which is also potentially true, but that wavelength can have, and so for people with some chronic mood disorders, for people with things like fibromyalgia, some of this red light therapy really seems to help them.
Right.
And it's safe. Doesn't really have any side effects.
Right. Yeah. We also talk about just different lab testing, so obviously something that we do a lot here in the clinic at Functional Medicine Associates, where when we're getting lab panels, we're checking, iron levels, inflammatory markers, vitamin levels, omega-3, cortisol, DHA, a full thyroid panel, insulin, fasting insulin, and fasting glucose, and then we can determine some different scores there to help understand if there's insulin resistance going on, which we already have covered, how significant glucose elevations
because I think if you're suffering from some of these other things, like how do you know, like, so what if your iron is in the tank? Like, what if you're, and you don't necessarily have to be anemic, meaning you can have normal blood counts, but your iron, your iron stores in your body can be super low. The last thing that happens when you're iron deficient is that your blood counts go down. The first thing that happens when you're iron deficient is your brain gets iron deficient, and then it can't make all the other happy chemicals, and it can't function properly. So what if your fatigue and depressed mood type of thing, what if your iron is super low, and how much better could you potentially feel if all of a sudden you start remedying some of these things? I'm not saying we're gonna miraculously cure, but like there's plenty of cases where we fix people's iron and all of a sudden, my God, they feel better. Or you actually have celiac, and you take the gluten out of the diet and everything starts working better. Or same thing for vitamin D, or if their omega-3 levels are wicked low, and then you start taking some supplements, or eating more fish and correcting that. That these targeted things, again, information is power. You always say it, information is power. And if you're not recognizing that these other things could be a factor, maybe it's time to pay attention to them.
Right. Yeah. And have somebody who will do some of that testing for you.
Yeah. So this next line, I just wanted to kind of clarify. So this was it's actually a psychiatrist who was giving some lectures for our functional medicine education, and there's a slide on there, and it really I thought was very appropriate. And he's like, always remember though, in depression, action precedes motivation. Like when you're depressed, the hardest thing to do is to get motivated to exercise, to get motivated to clean up your diet. So I think two things. One is recognizing that, and that whole kind of fake it till you make it, and then when you start feeling better, then all of a sudden the motivation comes secondary, especially in depression, but also getting help, the right help, which, can include mental health professionals. But I think health coaches also can play a huge role. It's like your external conscience.
Yes,
and your
right. And they're there to help you when you need that extra push. Trainer.
Trainer, exactly. So that external, so then they're helping that action that will precede eventual motivation to kind of stick to these changes.
That's such a good reminder that sometimes we just have to do it, and then the motivation comes.
Yep.
Yeah. So we also talked about, just a few of the resources. We've thrown out a couple books already, The Anxious Generation, The Headspace.
Yep. Brain Energy. That book.
How about the book you wrote?
Oh, yeah. So my book, Feeding Our Children, it's kind of a nutritional guide for kids from during pregnancy, for moms during pregnancy, all the way through school age. And there's a whole chapter on common nutrient deficiencies and how to kind of plug those gaps. And there's a whole chapter on brain health and how that's affected in kids by diet. So I think that could potentially be a useful tool for some people.
Oh, for sure. Yep. And you can get that on Amazon.
Yep.
And then ewg.org. So this is a great website we use a lot for understanding different household items, lotions, makeups, cleaning products, and how, compromised they are or toxic, or
and how to make better choices for all those things so that you can cut down on the toxic exposures that you or your kids are experiencing.
Right. So quite a few options here that we've talked about today.
And then the last website that I've actually found really useful, it used to be called anxietybc.com, but now it's anxietycanada.com,
That's right.
Our neighbors to the north. And it's a great website for just people, it's just general information about people with anxiety disorders. And they have a separate website for teens and then a separate sub-website for kids that just kind of explain it. They can go through it on their own time. So it demystifies these things, tells them how common they are, sort of what kind of symptoms are common, in different types of social anxiety versus, performance anxiety versus, all these other generalized anxiety and some other tools that are kind of linked into there. So it was just something I came across years ago. And for people that I see, it's like, well, here, you can just kind of look this over at your own time, educate yourself a little bit. And then all of a sudden they, I think sometimes can realize like, okay, I'm not crazy. I'm not alone.
Yeah.
That there's, and here's some things I can start doing, or
for sure,
maybe they're more motivated to accept some help at that point, or seek some things out. So
right, or just have that understanding.
Yep.
Yeah, have that basic understanding. Well, yeah, so as we're wrapping it up, so our episode on stress, we do always want to send a huge shout out. Thank you to Brandy Burke, our producer with Triple Divide Creative. She does such a fantastic job for us. We couldn't do it without her. Please, download, share,
leave a review.
Leave a review. Yes, that would be great for us.
Yep. And share it with your friends and relatives.
And jot down if there's a topic you want us to address. I mean, we're planning out the rest of the next couple of months of our podcast, but we're all ears.
Yep. Because once we get through the 6 pillars, then we're going to start branching out and doing some other things. And so you can get on our website at functionalmedassociates.com, and you can email us through there.
Yep. Perfect. That's a wrap. Thank you so much.
Yeah. Thanks for listening.